The first group of special tests we're going to do is we're going to focus on the neurovascular tests, so anything that's going to deal with circulation or the nerve response. So the first one is going to be the Tinel sign, and it's going to be for the median, ulnar, and radial nerves. So again, depending on where you're tapping is going to dictate which nerve it is. A lot of times people are going to come with pain, numbness, and tingling along that peripheral nerve distribution. So making sure that you know what the peripheral nerve distribution is going to be beneficial to know what nerve to test. Though it's pretty simple that you could do all three of them without taking up much time. So for the ulnar nerve, remember our Guillen's tunnel down by our pisiform and our hamate. That's going to be our location for the Tinel sign here. The Tinel sign simply being just tapping in that area. If that's going to cause pain, numbness, and tingling, that's going to be a positive test for that. Our median nerve is our carpal tunnel nerve, right? So if we just find our carpal tunnel area and we just tap there with that, again, if they have numbness and tingling down into their fingers, down into the median distribution, that's going to be a positive sign. And then our radial styloid, or our radial nerve, is going to be just proximal. Let's have you rotate there. Just proximal to that radial styloid process. So if we have the radial styloid process, it's going to be right here, just proximal to that, and we're just going to simply tap there, and they may feel that numbness and tingling down into their thumb with that radial nerve involvement. The next round of tests is going to be the Phalen's test and then the reverse Phalen's test. This is going to be a test that you're going to want to do if they're complaining of pain, numbness, and tingling along the median nerve distribution. So for the Phalen's test or Phalen test, you're going to have them put their back of their hands together. So if you put back of your hands together, okay, we're going to have them put their arms up, make sure their hands keep touching, and then you're going to have them drop their elbows down, which is really going to compress in that median nerve with that extreme wrist flexion. Go ahead, relax. And we're looking for the pain, numbness, and tingling in that area. The reverse Phalen's test is simply just kind of doing your prayer hands, and again, really causing that you're doing extreme wrist extension in this area, but you're still going to be putting pressure on that median nerve, causing pain, numbness, and tingling down that distribution pattern. That's going to signal, if we have that positive response, the carpal tunnel syndrome is going to be for that. The third neurovascular exam is going to be the Allen test, and this is going to be taking their radial and ulnar arteries and trying to occlude them. We're going to do that by finding the radial and ulnar arteries. We're going to have her open and close her fist or her hand. Keep going, keep going, keep going. Just keep going. As you're doing this, you can see that the hand gets really, really white because the blood's coming out of the hand, and then I'm occluding it from returning. So what we're going to do is we're going to have her hold her hand up. Okay, and then you could just let one side in, the other side, you can let them off at the same time and see to make sure that the blood is rushing back into the hand at the equal quantities for both of that. If you have that uneven filling response, we're going to be concerned with some sort of circulation restriction in the hand. Froment sign is a special test that is done to determine if there is some sort of adductor pollicis paralysis. So what you're simply going to have them do is you would just have them take a piece of paper and hold it between their thumb and their finger. Hold like that, and then you're going to pull away, hold it, and you're going to try and pull that piece of paper from them. Let it go. If they're unable to hold it, right, we're going to be concerned again that that adductor pollicis is is injured and potentially causing paralysis with that muscle due to the nerve. The last one is the wrinkle test, and this is done for median and or ulnar nerve pathology. And all you simply do is get a bowl of warm water, have them stick their hand in it. For 10 minutes, you're just going to observe to make sure that they wrinkle. Typically, if you're in a bathtub or a hot tub and you start to soak, you get your fingers get all wrinkly, and that's a way to keep your dexterity when you're underwater. It's kind of a fun
Your
human
hands are
response.
wrinkly.
What a positive sign would be is that you take your hands out of the warm water and there's no wrinkling. Okay, so their hands look the same. And that's going to indicate there's probably some sort of nerviated tissue in that area.